Hello everyone, my name is Charles Conselman and I'm a third-year medical student at McGovern Medical School in Houston, Texas, and I am presenting our research poster which is titled Gait Speed in Older Patients with Osteoporosis, a preliminary report from a primary care geriatric clinic. The co-authors of this study are Dr. Goldstein, Dr. DeBoard, and Dr. Rhiannon, and I'm very grateful for all the hard work that they put into this research. Now, a few things to know before we discuss the study we conducted is that number one, gait speed is an indicator of frailty. Number two is that frailty can predict functional decline. And number three is that functional decline has been found to be associated with osteoporosis. Now, currently little is known about gait speed's association with osteoporosis, and improving this knowledge gap may help target interventions to improve outcomes in our osteoporotic patients. The aim of this study was to determine if there is any association between gait speed and osteoporosis in older patients. Now moving on to our methods, this was a cross-sectional study in adults 60 years and older seen at a Center for Healthy Aging in 2019 to 2020. Their gait speed was measured using a timed 6-meter walk test. The patient's physical function was also assessed using grip strength, which was measured with a handheld dynamometer. The characteristics of the patients seen in Figure 1 were gathered from their electronic medical records, and these characteristics included age, race, and the presence of diseases including osteoporosis, hypertension, diabetes, hypothyroidism, arthritis, and depression. Osteoporosis was diagnosed in patients with T-scores of -2.5 or less. The associations between gait speed and osteoporosis, adjusting for the patient characteristics, were determined using a linear regression analysis. And now moving on to the results, you can see in the first figure that we have labeled the percentage distribution of patient characteristics which we have previously mentioned. We divided age into those 75 years and older, which made up a little over 50% of our study. Race was broken into Caucasian and non-Caucasian, with Caucasians making up 73% of the patient population. Over 50% of patients were positive for osteoporosis, 73% had hypertension, only about 10% had diabetes, 35% of patients had hypothyroidism, 27% of patients had arthritis, and 27% had depression. And in Figure 2, we have some of the data for you to see from our linear regression analysis. Now, in this study, a total of 37 patients were evaluated for gait speed, with 35 of them being female. The mean age of patients was 77 years old, the mean gait speed was 13 seconds, and the mean grip strength was 43 pounds. And what we ultimately found in this study was that longer gait speed was associated with osteoporosis, depression, advanced age, as well as weaker grip strength. What we concluded was that slow gait speed, osteoporosis, and weak grip strength are thought to reflect a depletion of physiological reserves that we know occurs in normal aging. The significant finding of depression with longer gait speed could be due in part to the loss of physical function seen in older adults. Importantly, our takeaway from the study is that using gait speed as an indicator for osteoporosis could lead to preventative measures being taken sooner, which could lead to better patient outcomes. Thank you very much for listening to my presentation. If you would like to see our references, please scan the QR code at the bottom of the poster, and have a great day.